Good afternoon, everyone. We are live today at Sakra World Hospital, Bangalore. We have with us Dr. Ajay Handa, who's a senior consultant pulmonology. Dr. Ajay Handa has a vast experience of over 3 decades and has served armed forces medical services before joining Sakra World Hospital. He is a DM Pulmonary Medicine from PGI Chandigarh and an enthusiastic marathoner. It is a pleasure to have you on board, Doctor. Today we will be talking about sleep apnea.
Thank you, Deepthi. Dear friends, thank you for joining us for this session of Facebook Live. Why I chose this topic of sleep apnea is that our lifestyles have changed. We are not able to do so much of exercise because of work pressures. Our dietary habits have changed. Overweight problems and obesity has become a disease, and it is intimately related with the problem of sleep apnea. The fatty deposition of fatty tissue in and around the tummy also impacts your breathing, and we shall see why. And that's the reason I thought that this should be discussed. The prevalence of sleep apnea in Indian population, males is about 5%, females is about 2.5%. So females also do have this problem of sleep apnea. By and large, it is a problem wherein the person in his sleep, the upper parts of the airway which connect the mouth to the windpipe consists of pharynx and hypopharynx. These are soft areas where the muscle tends to be very, very pliable and floppy. When the individual is in deep sleep, these muscles tend to become floppy and they collapse, closing the windpipe, leading to snoring, slow breathing, or lack of air entering into the lungs, or cessation of breathing if the closure is complete. These episodes happen throughout the night, multiple times, causing sleep fragmentation, disruption, and repeated awakening, either physically or awakening in the form of an abnormal jerk, gasp, nightmare. And the end result is the person wakes up in the morning not feeling fresh and having sleepy episodes throughout the day, leading to poor concentration. And the other effects of this disease are varied and protean, which we shall discuss through the day. So the awareness is poor in the population, and also the awareness is less in the doctor community who are dealing with these patients when they come with such non-specific symptoms.
Doctor, here are a few questions from our viewers. What causes sleep apnea?
So as we discussed, it is a lifestyle disease. So individual having a weight which is above his ideal weight develops a tendency to develop obstructive sleep apnea. The fatty tissue, as I was mentioning, tends to get deposited around the upper part of the air passages, the pharynx and the hypopharynx, reducing its diameter from normal individuals. So individual who is overweight, if he becomes more overweight, that is if the weight crosses 30% of his ideal weight, he tends to become obese, where the body mass index is calculated based on his height, and that is a figure of 30. Normal body mass index is 18 to 23. It would be, if it is crossing 30, then it is considered to be obese. So obese individuals are at 4 to 5 times risk of developing obstructive sleep apnea syndrome. The other risk factors for sleep apnea include history of smoking, having a family member who has sleep apnea. In about 25%, it is genetically transmitted because they also tend to be slightly obese. In a younger individual, like a teenager or a child, it could be because of tonsil enlargement or adenoid, which is a similar kind of a tissue in the region of the base of the tongue, that's just behind the tongue. It could also be seen in more common in patients with thyroid less function or hypothyroid function, as well as problems where there is less function of the pituitary gland, giving rise to development of fatty tissue in and around the tongue, causing the tongue to enlarge. So any other situation where the tongue also enlarges, the windpipe and the upper part of the pharynx gets compromised. So anything which crowds your air passage can cause an increased incidence of sleep apnea.
Okay. So I've often heard people tell me, I woke up with a gasp for breath, or I felt I was not breathing for a few seconds. So what are the warning signs of sleep apnea?
Okay, so it's very important to understand the warning signals or warning symptoms of sleep apnea. Snoring happens to be the most common symptom of sleep apnea. These snorers are very loud, and they will disturb the spouse definitely. They also may disturb the household which is sleeping in the adjacent room. So if you have episodes of very loud snoring where your spouse is poking you at night, or nudging you by the elbow at night, you are possibly at 3 times the risk of having a sleep apnea confirmed on a sleep test. So that is one, that is your loud snorer. Along with that, if you have the symptom which Dipti described, that you are waking up with a gasp, or you are waking up with a choking episode. Many times you will wake up with an episode where you felt that you were not having enough air. And these episodes, if you are waking up, that means you are having a critical occlusion. Many times, if it is lesser, you will not be waking up, but the episodes are ongoing inside the body. That leads to a fragmented sleep, a poor quality of sleep, and you wake up in the morning feeling non-refreshed, and in the daytime where you should be alert and active, you are feeling sleepy. It could go to an extent where you would be sitting in a meeting and possibly sleeping, or you could even be having an accident in a place of work if you're working with machinery, or possibly a motor vehicle accident. So if these things are there, possibly you have a warning signal. There are certain subtle signals which are ignored. That could be waking up in the night to use the washroom, which a person never did earlier, especially if a person is waking up in the night more than 2 to 3 times to use the washroom. That could also be a subtle signal. Apart from that, feeling of headache in the morning on waking up is an important symptom. You could also have symptoms such as poor concentration, losses of memory. Many of these patients will land up with a psychiatrist for forgetfulness, or anxiety or panic attacks. I remember a patient who had presented, who was a professor, who came to me saying that in the classroom these days he's having a loss of thought when he's teaching. He used to be a very admired teacher, and then he felt very embarrassed that I'm having a loss of thought process while I am teaching, and I tend to come out of the class dissatisfied that I couldn't do the job to the extent that I used to be. And then he was diagnosed to be having sleep apnea. So it can cause loss of concentration, it can cause you to have memory lapses, and loss of memory is also a symptom of sleep apnea syndrome.
You already explained a few risks, but are there any risk factors related to sleep apnea is another question which is coming.
Okay, so I don't know if I mentioned, but there is an association of sleep apnea with smoking. So individual who is smoking is at risk for sleep apnea. Individuals who are habituated to alcohol are also at risk for sleep apnea. Apart from this, it has been also seen that patients who have nose related problems, that is, they have allergic nose problems or nose obstruction, also since the passage is common, they also are at a greater risk for developing sleep apnea. Apart from children who could be having developmental anomalies where their face is not developed as well, that is the upper part of the face, and the lower part of the face, when the jawbone, that is the chin bone, is either small or slightly receded. Because as you can imagine, if the chin bone is slightly receded, so also the tongue also is slightly back. So the passage behind the tongue and between the back wall of the throat, that is the pharynx, is reduced. So these patients are at a greater risk, and they also will have possibly greater chance of developing sleep apnea.
Okay. What are the tests used to diagnose sleep apnea?
So first would be to look at the symptoms. So you need to see a doctor and possibly if you come to an institution where there is a department of pulmonary medicine which deals with diagnosing sleep disorders, they would like to administer you a questionnaire wherein the same symptoms, whether there is sleepy disturbance in the nighttime sleep, where you wake up, have fragmented sleep at night, choking episode, gasping episode, nightmares, etc., and in the daytime, whether there is excessive daytime sleepiness involving activities which don't really require a lot of attention, moderate level of attention, and serious amount of attention, like motor vehicle driving and working with machine tools or attending and conducting a meeting, and these would be administered. Once the risk is deciphered, and of course the physical check of the person, you decide whether the risk of sleep apnea is high or intermediate or low. Once the scoring has been carried out and the risk has been decided, you come to know what is the likely probability that the individual is most probably having or less likely to have sleep apnea. Then the test used is a test called a sleep study, which is ideally carried out in a hospital with a sleep lab. Sleep laboratory is a place in the hospital which is very much like your own bedroom. It would have a normal hospital, normal home bed. It won't have a hospital bed. It will have good quality linen. It will have a good ambience, dim lighting, so as to make you comfortable and possibly allow you to sleep as well as you sleep in the night at your own bedroom. Then the parameters which are tested in this sleep study include parameters for seeing the brain waves, that is electroencephalography. You see the muscle activity of the eyes and the chin. You see the muscle activity of the legs. You see breathing pattern, that is the patient's movement of the chest and patient's movement of the abdomen during respiratory efforts. You also see level of oxygen that is there in the patient's blood by the pulse oximetry, and you do an electrocardiographic monitoring for the heart, and there is a microphone in the neck to see the snoring, and a position monitor which tells whether the person is sleeping in the flat position or is sleeping on his tummy or on the right or the left. All these parameters are recorded in an overnight fashion and analyzed in the day with the score, which will tell that how many times in the night your breathing was stopped for more than 10 seconds, and how many times in the night your breathing was less but did not stop but caused a significant drop in the oxygen levels, causing your brain waves, that is the EEG, to show something which is called as a micro arousal. You are not awoken up physically, but your brain waves are showing the pattern of micro arousal. So these technical terms of apnea for a stoppage of breathing and hypopnea for a breathing which is less than a normal breath and also causes the drop in saturation with a micro arousal. This is calculated over the period of hours that you properly sleep, and then an index is calculated which is called as an apnea hypopnea index, and if the value is more than 5 per hour, then you are diagnosed to be having obstructive sleep apnea. There is another type of sleep apnea where the brain fails to generate any signals to the respiratory muscles. That is called as a central sleep apnea. Obstructive apnea is the commonest apnea encountered in clinical practice in 85% of people. Central apneas are seen less commonly and happen to be seen in patients with underlying brain disease or heart disease. So central apneas is a separate topic, but it is not likely to be there in the community. But if it is there, the doctor will find out and then the test will show a central apnea.
Okay. In these times of COVID fear, you know that people do not want to come to the hospital. Can they consult from home and get treated from home? I mean, can a sleep study be done from home?
So that's a good question from the point of view of the current situation that we are all in, and we tell the patients to maintain social distancing and avoid hospital visits as far as possible. So if you have the warning signals or suspicion, and especially if your spouse has been waking you up for loud snoring, more so if she has been or he has been waking you up for episodes where you have stopped breathing, that is an apnea, that the spouse needs to wake you up. So these are 2 or 3 signals which make the possibility of an underlying sleep apnea very high. So you could approach your doctor. We at Sakra Hospital have the facility of teleconsultation, and at the teleconsultation, if these symptoms are suggestive, then we also have the possibility of arranging a home sleep study, and that could also be carried out with a reasonable amount of assurance and sensitivity that the underlying parameters which are captured. Mind you, the home sleep study does not have all the parameters that I described in the hospital-based sleep study, because the hospital-based technician attended sleep study, where the technician is in the adjacent room through the night and is watching the patient, is the gold standard for diagnosing sleep apnea in the entire world. But a home sleep study could be carried out in people who have a high pretest probability, monitoring certain parameters, and it could be done at home as well.
Okay, so I think this is going to be a relief for certain people who have the fear of coming to the hospital.
I hope we can help them.
Yes. What conservative measures can be used to manage or prevent sleep apnea syndrome?
So the bottom line I would like to emphasize upon here is, since it is a lifestyle disease and very, very closely associated with being overweight and obese, so maintaining a healthy lifestyle is very, very important. Bringing some component of exercise in your life is very important. Again, 3 times a week, regular exercise, 20 to 30 minutes a day. Mind you, those people who haven't been exercising and who have hypertension, diabetes or underlying heart disease, please see your physician before you start exercising, because they need to clear you that you are fit to start your exercise schedule. And always begin gently. And the best exercise is normal walking, then brisk walking. So first thing is lifestyle changes, exercise, watch what you eat. There are some certain important exercises of the muscles of the throat. These muscles are neglected. Muscles of the throat and tongue play a very important role in development of sleep apnea, because that's the area which is weak, which is floppy in a person who is having sleep apnea. So if you strengthen them, even the yogic exercises under the advice of a trained yogic therapist could be wonderful, and could help you in a big way in preventing the occurrence of sleep apnea, even if you are in the border zone and predisposed to developing sleep apnea.
Okay. Does Cpap therapy have side effects?
So once a patient is diagnosed to have sleep apnea, based on the presence of symptoms, that is, if he has nighttime symptoms, choking episodes, loud snoring, and episodes where he is gasping and getting up suddenly, or he has daytime symptoms when he is waking up, that he has got excessive sleepiness and is unable to perform his normal activities, lapse of concentration, then what is the treatment apart from Cpap? Step 1 is lifestyle. Back to lifestyle. Encourage the person to reduce weight. He should try to get back to his ideal body weight, or as close to ideal body weight as possible. So improve your diet and bring in some exercise into your life. Number two is sleep hygiene. So sleeping at a fixed time, and not reading from a smartphone or a television or a Kindle for an hour up to an hour before sleeping, having a meal 2 hours before sleep, and then trying to lie down. In a patient with sleep apnea, lying down in the flat position, that is on your back, is the worst. So what is advised in such people is to lie to either right side or left side. So how do you ensure that? Very simple. You could make a night suit which has got a pocket in the back, in the middle of the back, and you put a tennis ball in that and you sew that pocket.
Okay.
And then the patient lies down, sleeps. When he goes to his bag, the tennis ball will nudge him, and again he'll come to either right side or left side. A very simple thing, but it is helps to develop a habit. Once the habit is formed, generally it should be okay. Now coming to the crux. Treatment of sleep apnea is with a device called continuous positive airway pressure, abbreviated as Cpap. Continuous positive airway pressure is delivered by a box sized machine which essentially delivers positive pressure through a tubing to a mask. The mask is strapped to your nose or face and nose, depending upon what type of mask. Patients who are mouth breathers because of nose problems, nose obstruction, would be advised, and this is done in the hospital before it is prescribed, that the patient is given a trial of the machine. Since it is a mask which needs to be applied to the face with a strapping, it's a little disconcerting, little uncomfortable. So the problems associated with CPAP are twofold. One is mask related and the other is the pressure coming out of the machine related. Mask related, the biggest problem is most patients will come back and say that I just cannot use it. The mask is too claustrophobic. So you try to give him an option of using a oronasal mask. That is a mask which covers the nose and the mouth, and it is a mask which is put with a strap, but the strap should not be so tight that your little finger cannot go between the strap and the mask with the ease. Little finger should go with slight amount of difficulty, and then there is a soft rubber which allows the seal to happen. So claustrophobia of the mask, the pressure of the mask on the nose bridge causing pressure sore or sometimes even a skin breakdown are very, very common problems. The other problems associated with the machine are positive pressure. Imagine you trying to breathe out against a positive pressure. That's the biggest patient's hesitation, that I am getting a sense of suffocation. I'm not able to breathe out properly. So it's always advisable to prescribe a machine which starts with a pressure which has got a ramp. So if you have a patient who requires a pressure of 15, it will build up slowly from 5 to 15 over 45 minutes. And these sessions are all done in hospital so that the person gets an exposure as to how this is going to feel like.
Okay. What can happen if sleep apnea goes untreated?
Okay, so this is a major problem, that if sleep apnea is unrecognized, or if it is unrecognized and due to the mask related issues or the device related issues, the patient is not taking the treatment. So either it is not treated once the diagnosis has been made, or worse, that the patient doesn't even know that he has a problem. So it predisposes to development of high blood pressure. As I was mentioning, you wake up multiple times in the night. This micro arousals or awakening multiple times at night leads to release of certain hormones in the body, adrenaline, noradrenaline and dopamine. These sympathetic hormones are meant to fight your situation of low oxygen in the night. But what this cumulatively tends to do is that there is occurrence of people with high blood pressure in patients who have untreated sleep apnea. Those who previously had hypertension, this hypertension becomes worse. There is an entity called resistant hypertension. Resistant hypertension is when the patient is taking 3 or more medicines and is not controlled with 3 or more medicines. Sleep apnea has been found to be there in almost 50% of these patients, and once you apply CPAP, their blood pressure control is achieved and you are able to get rid of the machine. So one, hypertension or poorly controlled hypertension leading on to resistant hypertension. Second, it can cause diabetes. 3, it can cause a person to have heart attacks. You could have a small heart attack or you could have a massive heart attack leading to sudden death in sleep. It is known because lack of oxygen in the night, which could sometimes be critical, can lead to heart attacks. There can be heart beating abnormalities which can sometimes be also life-threatening. There could be a patient who can have a brain attack, so called as a stroke. It could be a minor stroke to again a major stroke. So it is catastrophic. And let me complete by saying that patient with sleep apnea is 3 to 4 times more at risk for death due to any cause. In the US, there is a study where a patient with sleep apnea spends almost $1,300, that is almost a lakh of rupees more than a person who does not have sleep apnea on health related issues. So it's a very important thing to take care of and use your opportunity to get you diagnosed in time. And if you're already diagnosed, it's a request, please don't neglect the advice. Use the CPAP machine. It is a lifesaver.
True. What is the role of medications in treating sleep apnea?
Okay, so medications don't have much of a role in treatment of sleep apnea, since it's a physical change in the upper air passage during deep sleep. Medications do not do much to change the configuration of the air passage. Things like lifestyle, weight reduction are much more important. So those are important things to do. If you are in a very high pressure kind of a job or if you have a situation where you need to be very alert. Say for example, you have a meeting on an SOS basis, you could take a medicine to stay alert in the day, but only on prescription. For increasing the daytime alertness, there is a drug, but it's only prescribed if a person is using Cpap very, very religiously and very regularly, and still has slight amount of daytime sleepiness, and he wants to be more alert on a particular day. It could be used for a day or a couple of days.
Okay. How can you prevent sleep apnea?
So again, back to the most important thing. If you look at your weight, don't allow your weight to exceed the ideal limits. If you look at what you eat, and if you exercise, mostly you would have controlled the chance of having a sleep apnea. But if you have a structural problem with your upper part of your pharynx because you're having developmentally a floppy airway, or if you have lots of redundant tissues in that region narrowing the structure behind your throat, then trying out yogic exercises to strengthen that is a way. But possibly under the advice, get diagnosed, and Cpap and yogic exercises and lifestyle, you'll have to do all the three things together.
Is there any permanent cure?
So it's largely found that even patients who are very, very morbidly obese, that means their body mass index is more than 40, and have failed all kinds of treatments for reducing weight, so-called patients who land up with bariatric surgery for morbid obesity, many of them had concomitant sleep apnea, severe sleep apnea. So about 60% of them, the sleep apnea got better. That means their pressure requirement came down. They were able to use a Cpap with a lesser pressure, and hence they were able to tolerate the Cpap better. But to cure sleep apnea is difficult, and it is possibly going to be there. It's a lifestyle disease, it's a long-term disease. You put on weight again, it will come back again. So it is difficult to say that it can be cured. There's a small exception. If a child has a narrowed airway because of tonsillar enlargement or adenoid enlargement, and that is removed, possibly the growth of the air passages and the opening up of the air passages can make a big difference apart from his development and his quality of life. It also may be a curative surgery in such young children.
Okay. What is the role of yoga therapy in managing sleep therapy?
So yoga in sleep we discussed briefly. So apart from the general body fitness, if you have certain yogic exercises which are prescribed for strengthening the muscles in the neck, in the pharynx, in the tongue, then these could also help patients of sleep apnea whose use of Cpap has been found that they control their disease better. If you combine sleep apnea therapy of with Cpap and yogic exercises of strengthening, it's better to be done under supervision of qualified yoga therapists and yoga trainers who will teach you those muscle exercises of the throat and tongue, and a few minutes in a day, 3 times in a day. If you do these exercises, it improves the airway tone, and your apnea episodes will come down. But don't abandon the Cpap.
True. There's a question that is just common. Is sleepwalking connected to sleep apnea?
So sleepwalking is a disease which is completely unrelated.
Okay.
It's a different disorder, and it definitely will cause the person, and he will move around and possibly come back and sleep, and will wake up in the morning with no memory absolutely of the event. So whereas these patients will not have any of those symptoms of breathing difficulty, they will be totally normal in the morning. They have no pointers of obesity, snoring and all the things. So sleepwalking is not a condition which would figure. A condition which would figure in the differential diagnosis is a condition where there is excessive sleepiness due to narcolepsy, and that if the EEG is evaluated, it can be diagnosed. There is a pathological sleeping disorder, but again it is not associated with any apneas. There are no apneas or hypopneas in narcolepsy as well. So it differentiates. The EEG will be showing abnormality, and the oxygenation and breathing parameters will be totally normal.
Okay. With this, we come to the end of today's session. If you have any questions, you can leave it in the comment section. Our experts will revert back to you. It was a very interesting session. Thank you, Dr. Handa. Have a nice day.
Thank you.